Okay. All right. I think I just figured this out. So if you are joining tonight, you are familiar. NoCD treats OCD. It specializes in the treatment of OCD. And my name is Dr. Jesse Spiegel. I'm going to be filling in here. I am an expert in treating OCD and anxiety disorders for both kids and adults. So it's children, adolescents, and adults. I work in Los Angeles and I'm in private practice here. And I also do part-time work at UCLA, in which I provide CBT training to third-year psychiatry residents for on how to do CBT. So anyway, what we're going to do tonight, I'm going to answer questions. So you can feel free to keep sending them in. I'm new to this broadcast format, so you'll have to get used to me a little bit as I try to figure it out. Hopefully there won't be any errors along the way as I try to figure out how to highlight the questions. And I had some directions sent to me beforehand. So for the people who are reaching out here, probably a lot of you guys are already experts in OCD and kind of best treatments. But just to kind of go over the basics here, OCD, it's obsessive compulsive disorder. So you have obsessions, which are intrusive, unwanted thoughts, feelings that come up. The person does not want to have them. And then they engage in compulsions, which are basically behaviors to get rid of the obsessions. And they have a tendency to be repetitive and redundant. So anyway, let's go ahead and take a look at the questions here. I'm going to try to start from the beginning. Okay, so let me see. Here we go. Can OCD make you feel numb towards your values? I feel nothing towards my values, and I feel I have changed. I feel like I have to fight my mind. Can it also make it seem like it's not OCD? Yes, absolutely. OCD can throw you off completely. It can really blur the sense of who you are, what you stand for, and so forth. So this is a very normal experience to just kind of get lost in the world of OCD and basically lose your core sense of self. You're getting all these intrusive, unwanted thoughts and feelings that suddenly who you are, who you think of yourself becomes blurred and OCD takes over. And it's also very, very easy um, to just sometimes think you're not real and OCD is the one in charge. Okay, so we're gonna keep these questions coming along. How do I stop confessing every real event memory that pops into my head to my partner? My OCD is forcing me to believe I'm a bad partner and is trying to scare me into believing I don't deserve him. This is again where we can see OCD really can pick on people. And it can really suddenly get you to do certain things like confessing compulsions, where you say everything that comes into your mind. Perhaps it's coming from a fear that you are being not a good partner. And so as far as kind of how to break this rule, this compulsion, I'd say, you know, treat yourself with some compassion as well. But if you're normally confessing nonstop, I think it's very important to kind of get a sense of all the compulsions that you're doing and really just limit it to the most you can. Sometimes this could feel like a very, very big step to take. So one thing that you could do is if you're doing this throughout the entire day, you could schedule a specific time in the day where you really limit your compulsions. Again, this could be something like an initial first step to do. Obviously, though, really the goal is to completely reduce compulsions altogether. Okay, we're going to keep these questions coming. So Maddie sends a question: how to deal with uncertainty when it comes to depression. So sometimes OCD and depression can come on together. So sometimes OCD can be a standalone diagnosis. Sometimes it can co-occur with depression. As far as dealing with uncertainty when depression comes, Um, I would say depression can be something that sometimes just comes up at times. And basically, if you think about it, everything with every thought and feeling we have, that there is somewhat of a transient feeling, transient thought. If you take that perspective, that it is not endless and forever, well, lo and behold, depression can be less intimidating, especially for people when they have a tendency to obsess over it. So that may be a certain approach that you could take. Okay, and just also to give some information as well. This broadcast will be for about 50 minutes, so I'm going to try to answer as many questions as I can during this time. And also, more importantly, I realized I forgot to say, since I'm still getting used to this new format with this YouTube, I forgot to say Happy New Year's to everyone. Okay, so Robert asks, when you feel your body automatically tenses up, is that a ritual? And should you try to relax your muscles into it, or just let your body stay tense? That is a very, very good question. How I try to distinguish as far as rituals or this tense feeling in your body, I think of rituals. What I would try to say is your perspective could be, our rituals are they're an overt behavior that one does. So it could be something physically that one sees. So if someone kind of felt tension in their body and lo and behold, they needed to move the curtains, well, that is an overt behavior that one would see, and which is very clearly marked as a ritual. Or if one feels tension and lo and behold, now they need to say something in their thought in their head in response to it, saying something along the lines of, I got to get rid of this tense feeling I have. This has to go. I have to get rid of it. I have to get rid of it. It will go. It will go. Something, again, that repetitive nature. Well, that's going to be more clearly a ritual. If one just feels, let's say, in response to whatever it comes up, a scary thought, a tense feeling in their body, that is a normal physical reaction. And actually, within ERP, what you would want to learn to do is learn more to kind of stand and be able to tolerate and handle some of these feelings that come up into your body. And just if your muscles tense up, your muscles tense up. Again, kind of going back to what I said in the prior question, these things are temporary and not permanent. Okay, here we go. Next one. Does NoCD have recommendations for psychiatrists for medication management that specialize in OCD as well as therapists? I'm looking for a new doctor who will know more about OCD. And what I would say to that is, probably I don't actually work for NoCD specifically, so I'm filling in right now to provide the consultation work. And as far as psychiatrists, I would say reach out to the care team, and they should be able to provide some answers to those questions. We're going to go to the next one here. Okay. Hi, Jesse. I have hyper-awareness OCD, and it's kicking my ass. Any advice? Avalon, believe in yourself. OCD is blurring it. Hyper-awareness OCD, it can be very difficult. It can seem very, very overwhelming. But what I would just say is, take it one step at a time. Ideally, if you're working with a clinician, there's ways to kind of like subtly mark some progress that you've made. One thing that I do with a lot of people is really get a very, very keen sense of all the compulsions that are going, all the things that you may be doing. So everything that you're doing to kind of have more and more of an awareness, things you're doing in your head, things that you may be checking. And when you get that list, well, let's see if you can kind of slowly but surely break some of those compulsions, break some of those rituals down. And what I would say is, like, have patience. Nothing comes out so easily, and then just take your time in making the progress. Okay, and the next question: how to deal with OCD when the feared event is too difficult to accept? That is a great, great question. And I'd say the reality is OCD will pick on what is near and what is value and of meaning to you. So for some people, It can kind of, if you have a religious Catholic person, it can suddenly bring on a feeling with scrupulosity that lo and behold, the person could go to hell. And this can be very, very intimidating. Um, and for other people, if they have children or a loved one, suddenly it could bring up thoughts of what if they were to do harm OCD to them? What if they were to do something harmful to them? And this can be very, very overwhelming. And I think what I would suggest here is OCD is not going to pick on things that are lacking meaning to you. That, as far as thinking about it from the whole uncertainty piece, OCD is going to pick on what matters to you, what you want to know for certainty, because it's so important to you. And so keeping that kind of general broad view as a perspective can be quite helpful. And just knowing that, hey, this is not easy to accept. This is going to be something challenging. And it's not surprising that OCD is coming after this for me. Ultimately, as far as kind of within the progress, it still involves some movement towards the uncertainty. Again, nothing in life is guaranteed, and that can be very scary for things that are of value to us. Okay. I had breast cancer diagnosis 5 years ago, and that started the I'm assuming that meant to say obsessions. And again, I'm sorry if I can't see it. I'm guessing there was supposed to be a little bit more to this question. And so maybe we can get more of the question that comes up in a little bit. But I'm guessing that this may be an intrusive fear related to that a reoccurrence of breast cancer. And again, this is something that's very scary. And these are real things to even process as far as an emotional reaction to such a, a a challenging life experience. And so it's a very normal experience to fear a reoccurrence and so forth of something scary like this. How do I stop letting my relationship OCD control my life? So for those of you who aren't familiar with it, relationship there's a whole lot of subtypes with OCD, and relationship OCD is basically intrusive thoughts that perhaps I chose the wrong life partner, perhaps this partner wasn't meant for me, a really uncertainty around the relationship. And again, OCD is going to go on themes that matter to you and are of meaning. And again, a challenge that I would say here is obviously I'm not going to provide you with reassurance here, and that's not my goal, even with any of these questions. But what I would say is, how do I stop letting relationship OCD control my life? Try your best to kind of really value the relationship and what is meaningful for you. And things that are compulsions, things that you may be trying to answer your questions in your head about yes or no, is this relationship perfect or not? Understanding that this is really OCD acting. So if you value certain things with your partner that are of meaning for you, spending time together, shared interests, really try to get in touch with this perspective, and just really to keep in mind again the values piece of what you're liking with a relationship. And you can never for sure have certainty within a relationship. Okay, so can you talk about how to treat OCD when it overlaps with an eating disorder? Um, what I would say here again, and I'm really only going to be able to provide like a brief understanding to these questions, just due to a limit within the time, and honestly, it's hard for me to sometimes answer some of these questions of a brief question. But what I would say is, uh, for someone who has OCD and an eating disorder, you'd really want to work with someone who has experience in working with both of these populations. Within an eating disorder, what I would generally say is if it's, let's say, anorexia or bulimia, there's other eating disorders as well. you would really want to make sure the eating disorder is carefully monitored. So, for instance, if someone has a very low weight, that would need to be addressed beforehand, before working really on the OCD. Um, Now, once when that is a little bit more in check, I think it's a little bit easier then to work on the OCD. But if someone has a very, very low weight, you really need to address that first. And also, sometimes with OCD, it has a tendency to pop its way in some type of to mess up the eating habits altogether. So sometimes people may need to chew a certain way, and this can also impact their weight as well. So if they need to chew like a certain amount of times on the right side, or it can have a just right feeling, this can impact their weight, in which that can be very clearly worked on as far as within treatment for the OCD. What can I use to replace pulling my hair? I can't find anything that feels satisfying enough. Um, what this is referred to as OCD related disorders would be my best guess, as far as what based on the question the person is asking. And you would want, as far as for some of these related disorders, what this one, it's a handful as far as to say for a hair pulling disorder, it's called trichotillomania. And within trichotillomania, what you first want to have is a higher level of awareness of when you're pulling at your hair, and to get that more of that increased awareness first. And as you start to get more of that awareness, um, you then can where you're doing it, certain sensory feelings that are coming, places that it's coming up, where your hand movement may be, as examples. You would then want to find something that could provide with a similar stimulus, similar feeling, similar experience to what you're getting from the hair pulling. So, uh, some examples could be a brush, some type of scrunchy ball that you could use with your hand. Again, really in those areas that could be a little bit more triggering. Again, I would say something like this is something that I would recommend always working with a therapist that specializes in OCD and OCD related disorders. Why do unwanted thoughts feel real? Because they are a real pain in the butt is the honest truth. It it is so tricky, and honestly, that is what's so intimidating about OCD is they really, really they hit you hard and they are endless. Um, so with those unwanted thoughts, it's OCD is not going to be easy. I like to think of it like kind of as a boxing match, that OCD is going to be a bit relentless, and they're going to really attack at things that are quite real and intimidating to you. How do I stop ruminating? Well, I would say if I could answer that just in this one YouTube, that would be perfect. What I really think a great way, as far as kind of just first identifying how you may be ruminating. Um, and again, ruminating, thinking of it as those mental compulsions, ways that you're trying to answer OCD's questions. So, um, for instance, if someone had pedophilia obsessions, intrusive, unwanted thoughts that they could be a pedophile, they may be trying to answer the question, yes or no, am I a pedophile? And just really thinking of kind of in more of that black way, how you're trying to answer the questions or where you're getting stuck. That may be a way where you're compulsively ruminating or having a mental compulsion. Um, if you're having harm related obsessions, again, you don't want to engage in any harm, but lo and behold, you're getting these intrusive, unwanted thoughts that you could harm someone. Yes or no, you're trying to answer these questions. It really, OCD has a tendency to be very black and white. And so when you're trying to engage in that black and white thinking, this may be reason that I'm really an axe murderer. No, no, this is why I would never do it. Again, it's really going back to that black and white, and it's not living in the gray. Can you have intrusive thoughts about an ex? You know, you can have pretty much intrusive thoughts about just about everything, as far as professionally, what I've seen harm-related obsessions, I've seen pedophilia obsessions, I've seen obsessions related to just right feelings. I've seen contamination obsessions. I've seen obsessions over whether people think they are real or not real. Are they living in a matrix? And we were talking about ROCD, relationship obsession. So, kind of in that vein, yes, you can get intrusive thoughts about an ex that would be very consistent with the relationship obsessions. Maybe having doubts if you are with the current right partner, or you should have never left your ex. So that is a very natural feeling, a natural experience within OCD. What I would also say though is to keep in mind, as far as can you have intrusive thoughts about an ex, that can also be a normative experience too. So something that's not necessarily related to OCD. So if you think about it, if someone had a recent breakup, well, it's very normal to experience kind of thoughts that you wouldn't want to have, thoughts that are, make you feel sad, overwhelmed, whether you yourself were the one who ended the relationship or the relationship was ended, they ended the relationship. That's a very normal thing to happen. So it can be a bit blurred at times, whether in those cases, whether it's OCD or a normal experience. But what I would say is if it's coming nonstop, it's been significantly, time removed, then it may be more OCD at that point. It really can depend on a case by case experience. Um, okay, so and why does OCD affect my memory, making me think I did something if I really didn't? Um, So OCD, just think about it overall as like a doubting disease. OCD 100% wants certainty. So there can be this thing called false memory obsessions, which is essentially intrusive thoughts. Maybe you did something when probably in reality you didn't. So sometimes someone could have an obsession that, lo and behold, maybe actually they got drunk once when they only drank one drink and they had a full sense of their memory, but maybe they actually did something that they would fully regret. Again, it's that piece that the OCD mind is really working to get 100% certainty, because lo and behold, if you did do whatever such thing was that you would regret, lo and behold, OCD needs to know with 100% certainty that you did not do it. Again, OCD is going to always attack what is near and dear to you. I've been trying to do the treatment for OCD as best as I can, but it just feels like a square peg in a round hole. How do I know I'm doing the right thing? Well, you can never know for certainty, which I know really is probably an answer that you'd want to hear. That's a bit of sarcasm, which may be hard to hear when doing a broadcast of just myself. But as far as how you're doing the right thing, what I would say, there are all sorts of communities where you can get support for other people who are struggling with OCD, and you can find other people um, who have been in similar circumstances. So NoCD definitely does offer some various support groups where people can find other people who also have OCD and have had similar experiences. The International OCD Foundation, IOCDF, also lists a lot of support groups as well. So that may be as far as one way to number one, find others who are in kind of like a similar experience to you. Beyond that, it may also be about finding the right provider too, or the right therapist who you connect with and who also understands how to treat OCD too. Those are both really important pieces. Do you have any tips on, and by the way, I'm just going to say this, I'm reading these questions as they're coming up. I did not read the questions ahead of time. So if you hear me just kind of like stumbling on my words because I'm reading the questions ahead of time. I wasn't able to get, for those of you who did send in advance, I'm reading it on the spot and figuring it out with you. Okay, so do you have any tips on how to stop ruminating when the thoughts are so sticky that it feels impossible to get rid of? Well, that's not that's not it, that is a common experience. One thing as far as where you maybe sometimes when you get caught in ruminations and that kind of uh, the mental piece with obsessions and mental compulsions, it's very easy to just kind of get stuck in that hole and go deeper and deeper and deeper. There are Dr. Aureen Wagner. She is an expert in pediatric OCD. She uses an acronym called RIDE, and within that piece, one of the pieces is recognizing it's OCD, insisting you're in charge, doing the opposite. RIDE, doing the opposite, and E, just kind of basically enjoying yourself, giving yourself a reward. And I may not be getting that acronym exactly, but that is kind of the roundabout of what she's trying to say. So one thing, if you're starting to do the compulsions, you may just want to say, hey, this is OCD coming up right now. Um, and then just trying to like re-engage yourself as far as if you were doing an AA activity. So if you were with friends, you may just kind of just try to be again, oh my God, again, this is OCD. I'm going to recenter myself, try to re-engage in the activity. Again, there's no perfect solution. I think even with that suggestion I made, you need to be also mindful, because if you need to start doing that again and again and again, this is OCD, this is OCD, this is OCD. Well, lo and behold, it may be a compulsion that you're doing then at that point, because it's becoming a repetitive behavior in response to the thought. But really, honestly, one of the first pieces I think that's always important is just to really start evaluating all the ways that you may be doing these mental compulsions. Again, I'm going to try to do my best to get through as many questions as I can. How do you know the difference between false memory OCD after a night of drinking and a real event? Well, I suppose there is really no way to know for sure unless if there's some type of video evidence that would be monitoring your every move. And this is not me saying this. Would be to now see if you can get some videotape, because that could then become a checking compulsion. um obviously you can never really know 100% for certain. If you had completely lost your memory after, if you were doing significant drinking, and drinking can blur. Again, thinking about false memory OCD, it's going to really try and fill in the blanks, or if lo and behold convince you did something when you didn't do it, and that really is an example of when OCD may be popping up. Now, obviously, if someone had, let's say, a really really big night of drinking and blacked out, they're not going to have any memory of their experiences. Can you experience physical sensations from your OCD, specifically sensations linked to trauma? How do you deal with such physical sensations? So you can definitely have physical sensations from OCD. That's a OCD, if you think about it, is going to bring in often a lot of anxiety in some cases. If the intrusive thought, like if you're working on the treatment, it can bring in feelings of sadness. It's going to bring in all sorts of feelings, and if you've had a prior traumatic experience, um, that is a possibility as well of something that can occur. Um, how to deal with such physical sensations? Again, this is like a piece I know I've been kind of really hammering over and over and over again so far in this broadcast, but is feelings and thoughts are a temporary experience. They aren't permanent. They can seem extremely overwhelming at times, but they are always temporary. And I think if you have that in mind, that may be something that is helpful. That could bring in like an intense physical reaction, but it's not permanent. Now, if you're trying to do compulsions and really trying to get rid of the experience, it may prolong it. But the longer you can learn to tolerate such uncomfortable physical sensations and so forth, the less powerful they will be. Now, it doesn't mean that they're not going to come up again, but it means that they'll become less powerful, and lo and behold, they may take less meaning over time and something more that you can handle over time. I have this intense fear of not being able to sleep or causing harm in my sleepwalking. Can anyone else relate? Um, so as far as something like that, I always think if one really has significant sleep problems or and so forth, it may just be helpful to see a sleep specialist or do a sleep study beforehand. As far as doing harm in your sleep, assuming that's already been evaluated, doing harm in your sleep, I mean, OCD, people are going to find the once in a, I was going to say million experiences, but maybe even a lot less that one can do harm. And using that as proof that you may be one of those few examples. Again, OCD always, if I can't emphasize enough, always wants 100% certainty. So if you could say 9 million out of 9 million and one times that for sure you would not be that, well, lo and behold, it will look for that one experience, that you could be that one person who does harm. So again, this may be related to just always thinking in mind where OCD might be acting up. I've had health-related obsessions. For example, I thought I had an eye infection recently. I seriously checked my eye about every 5 minutes. How do I stop myself from constantly checking? Well, what I would say there is that there may be actually other ways that you're checking too. So it could be literally stopping and looking at your eye regularly. It could be looking up, researching things to prove on the internet that, with WebMD, that this may not be a worse infection. One thing is thinking of these compulsions, you want to break them, you want to do something different or do the opposite. So, again, this really may be something where, I would say, first off, always work with, whoever your clinician is as far as who's helping you work with the OCD. You don't want to avoid, you don't want to engage in avoidance, but lo and behold, if you're looking in a mirror every 5 minutes, perhaps putting up some type of sheet that would prevent you from looking in the mirror, prevent you from checking your eye. And you're going to want to make sure that if you, lo and behold, you did something like that, it doesn't mean you're going to find a loophole, such as like looking at your phone and finding some mirror, on there. You want to really just make sure you're not substituting one compulsion for another and researching and so forth instead and doing something else. What's the best way to stop ruminating? Again, really just thinking about this is really OCD acting up, just recognizing when it's coming, not really engaging in the back and forth and answering the questions, just being like, oh yeah, this is OCD coming up. I'm going to re-engage myself and so forth. And again, even with a lot of these support and ideas I'm trying to share with you guys, please always remember, like, you're going to want to work with your specialist because I'm really trying to answer these questions in the best way to give you some ideas. But obviously, as you know, they can be a little bit more nuanced at times. In my country, people mistake my OCD as psychosis. I think I have magical OCD. I keep feeling like people have magical powers and can do bad things to me. Am I the only one? What do I do? I listen, I always think that it's important to check in with a specialist to meet, someone who is whether they're some type of mental health provider, a psychologist, a psychiatrist, and to really get a thorough evaluation. I think that's always going to be useful. So, like we said before, sometimes it can be OCD, sometimes it can be something else, sometimes it can be some combination. But it's really important to get that thorough evaluation. from someone. Okay, how to manage doing our OCD compulsions that are normal for others, but part of the OCD cycle for me, such as communicating with partner about issues, checking in with them, asking them to improve in areas, etc. So, Olivia, what I would say here, think about OCD as, am I trying to get answer to some type of distressing feeling or thought that I might have? And whenever you're trying to get that type of answer, well, lo and behold, that may be where OCD is acting up. So for some people, they may be just trying to have um, a thoughtful, like, just a conversation with a partner and so forth, and nothing more than that. And lo and behold, well, that's a normal experience. And likewise, even thinking about that for yourself, am I just, engaging in a communication with my partner? That's a normal thing to do. Maybe just having a basic check-in with them, about areas related to our relationship and so forth. If it's being driven, and in a way, I say, I really want to emphasize driven, like I need the answer, there's a certain sense of urgency to that. Well, lo and behold, you may be now engaging in the compulsive behavior. And what I would say to that is, it's important to not act when you're feeling an intense emotional reaction, an intense thought. So give it some space. If lo and behold, you give it some space, and this feels like just something that would be an important conversation to have, but doesn't feel like it's going to be OCD, it doesn't have that sense of urgency, and you're having a less of an emotional experience, maybe then it's an appropriate time to talk about it. But otherwise, if it feels very emotionally driven, very anxiety driven, well, then it may be where OCD is coming up. And again, within relationship OCD, this can be a very, very blurred line. And, it is obviously some of the challenges that you can experience, because in relationships, it's normal to have different types of emotional reactions. What I would just say is, the main thing is, you don't want to immediately respond to it, immediately have to confess something, or immediately talk to your partner. Okay. Can OCD have rational origins, or is it just a completely random and irrational disorder? I have our OCD, again, relationship OCD, and I feel like there may be some rational roots, but I'm still struggling to figure it out. Yes, I would say OCD, they're intrusive, unwanted thoughts, but that doesn't mean that they came out of thin air. Uh, you know, they may have some real roots of where it came from. Like I said before, it could have, it's going to be always attack things that are of meaning. Uh, and at the same time, though, if you try to really get to the root of it, you're going to be engaging in constant mental compulsions of figuring it out. And you're really not going to get anywhere, and you're going to be more and more stuck. So, really, with OCD, it's important to treat the here and now, what you're currently doing in response to thoughts and feelings. You're never going to have a perfect answer by going all the way back, and you're just going to become more and more stuck. I really can't even getting my words jumbled up right now. I struggle with sensation obsessions. What are some good response prevention responses to sensations? So I would always want to, for Colleen, I would always want to know what you're doing to those sensations. As far as, because response prevention is really, it's driven based on whatever you're doing. So let's say if you ever have an uncomfortable feeling in your hand, well, lo and behold, you touch it. Or if you have this uncomfortable feeling in your hand, you tell yourself, oh, this must be a sign of cancer, and you're going over things in your head. These are things that you're currently doing, compulsions, which you're currently doing in response to these sensation obsessions. And what are some good response prevention obsessions? It's really going to be specific to whatever you're currently doing. So, I mean, if lo and behold, you needed to touch your arm every time you had that feeling, well, you'd want to break that specific compulsion and do something different. Again, it's going to be specific based on what you are currently doing. How to deal with uncertainty when it comes to marriage and you have a toddler. Well, this is something as far as if you have a marriage and if you have a toddler, um, it's a very normative experience to have doubts. It can be a very new experience, a very overwhelming experience. Um, and OCD is not surprising going to really be attacking you at this moment. And so, kind of keeping the perspective really as far as within all treatment with OCDs, you can never have all of the answers to every question. To just kind of like understand this, there's not going to be a perfect answer. Um, okay. And does trusting your partner become difficult with OCD? Sometimes it feels like all trust goes away and I give into compulsions. How does my partner and I tackle this? Um, Trusting your partner can come up. Um, what I would say is I think in this case, it's really going to be a two-piece answer. Part one is really going to be kind of a little bit you working on yourself, kind of really try to understand more and more ways where you're trying to get answers to questions related to your partner, and know with 100% certainty of something. And maybe your partner may be unintentionally giving you reassurance. Again, these are things that you can work on with yourself. You could probably have, if you're working with a professional, have maybe have your partner come into a few sessions as well, so they can understand where they have ways to reduce accommodating behaviors. And I'd say if it is leading to marital issues, it could also always involve having separate couples work too. So it's really kind of those are the two pieces where you can kind of work on stuff related to yourself, and maybe with some adjunctive sessions where the partner joins in appointments, or if you're actually having some marital related issues, to see a couples therapist. Okay. I have been in OCD remission for about 8 months. All the sudden, I feel like there's more to this question, and Dana, if I can find the rest of it, I will try to pull it up. I don't see the rest of this question, so unfortunately, I feel like there's more to it, but I can't answer it. Wish I could though. Okay, my unwanted thoughts are very disturbing and scare me. It gets so much more worse at night. Is suicidal OCD a thing? Not actually suicidal, but scared of the actual thought. Um, so obviously, this goes without saying. If there ever is an actual concern that you might harm yourself, you should obviously contact the National Suicide Awareness, or get immediate help for that. But let's take this example where it's more OCD, and again, thinking about it, um, where the person does not want to have the thought. Again, OCD, there's a term that's used, which it's ego dystonic. The person doesn't want to have it, then they're trying to do whatever they can to have it, again, versus ego syntonic. So maybe in those cases where a person was really feeling sad and they just did not want to live anymore, that would be more ego syntonic. So are suicidal obsessions a real thing? 100%. They fall in that harm OCD umbrella, where people can have thoughts about hurting others, but they can have thoughts about hurting yourself. And where I'd say, as far as the evening time has a tendency to really be a lot more of a pain for OCD. Your guard is down. You're more worn out. Sometimes, for some cases, if people can't fall asleep, lo and behold, now they're really stuck in the OCD land. And so, it's not surprising that it gets more scary. It could be also the kind of thing, you're more worn out and more, feeling like, oh my God, what if I did something accidentally? Again, it's very normal to have obsessions get worse in the evening. I have been in remission for a good 8 to 9 months now. Okay, so I think we got the rest of that last question. So, going back to the first piece, I'm glad we found it, Dana, is I've been in OCD remission for about 8 months. All of a sudden, I have it's now been back I've had a good 8 to 9 months now, but it's back and comes back at nighttime when I'm trying to go to sleep. So my OCD is awful at bedtime, and I can't sleep. Any pointers? Uh, what I would say is, probably it's always important with your treatment to just view this as like a lifelong thing that you have to commit to. So whether that's exposure pieces or just various ways to kind of always be pushing towards that uncertainty and doing things that are uncomfortable for you. That can be kind of something that can be useful as far as limiting the chances of a relapse. Um, as far as it coming back to sleep and making it coming back at bedtime and making it difficult to sleep, it's a little bit hard for me to answer this question without having all the specifics, and I'm obviously aware you would not want to put all the specifics on the YouTube. But what I would say is perhaps there are things that you could be doing that actually would be allowing you to face that discomfort during the day and be making some inroads that way. Um, so, if someone was having um, contamination obsessions, well, perhaps you could kind of do things throughout the day to approach that discomfort during the day and maybe even a little bit more into the evening. So, again, kind of viewing this as a gradual process. But my general sense would be is that if there's ways you could get this earlier on in the day and then just even continue on a little bit later and later, that would be good. Um, and also, if you had been working with a provider, I would say just to reconnect, that is just something that is a very normal experience. I will sometimes hear from um, patients where we haven't worked for a year, and they'll reach back out to have a check-in, and something that I do very regularly, where even when we're kind of um, moving away from the treatment and we're getting ready to stop, where we'll meet again, once every other month, once every 3 months, once every 6 months. So it's a normal thing. Just kind of thinking of it as like if you take care of your teeth, you're going to see a dentist once every 6 months, and so it's a normal experience to check in with your provider and someone that was helping you before. Okay, hi doctor. I have a friend with OCD. I am seeking to bring encouragement, but sometimes I feel like I am not doing enough to help. How do I do better? Well, Apple, I'd say it sounds like you're a really good friend. And to some extent, this is a journey that involves the person. It can involve others too. But maybe one thing to do is just check in and to your friend and ask how you can be helpful. You don't want to be providing reassurance. You don't want to be answering their questions to what's uncertain for them, but asking them what would be supportive to them, what would be helpful, can be something that can be quite useful. Again, without providing reassurance. I struggle a lot with accepting these things that come up and are temporary. I get lost in, okay, this is my new state forever, or at least for a significantly long time, knowing I'm about to enter a season. And I would definitely say for Tony, I feel like there's more to this question. This crushing me when we don't have uh, when we don't have the whole questions. But my general sense is this is just really kind of falls in the OCD paradigm where it can feel forever, it can feel unending, and so that is really an example of OCD not knocking on the door and popping its head. OCD can feel permanent, and that's really one of the main challenges with it. And so we're gonna go for another few more minutes, and then we're gonna stop. So I used to be able to manage unwanted thoughts and ignore them for about a year. Now they're stronger and unbearable. Any tips? Sometimes it really makes sense to see, contact a provider. Again, you have NoCD, which is a great resource for information, and you can again reach out to the care team and see one of the providers. The International OCD Foundation lists some wonderful tips. They list providers as well too there. But if it's feeling really unmanageable, I think it's a very acceptable time to seek help from a provider. Okay, I'm gonna try to get to two more questions and then we'll stop. Um, okay, so it sounds like someone is connecting with one of the prior experiences, which I think is great in providing that support. So, same, mine came back like a week ago, and I dwell on going home and relaxing and going back to sleep because I obsess over the anxious and panic feeling when I'm trying to go to sleep. So, again, Cameron, I think that's great that you provided that shared experience, and like we were talking about before, it's OCD often can really pick on you at night, and that's something that can really normally it can happen a lot. And Cameron, we're gonna get to your question as well. So, does OCD just take your worst fears and try to convince you that they are real? Sometimes they can feel a bit random, and why is it picking on me that I need to just have this right feeling in my body? And other times it can really go after what is near and dear to you. And it really just varies from my work. I mean, I think it often will hit you where it hurts because that's OCD knows you're going to get more stuck on it then. Um, so uh, that's very very normal, and they can really try to convince you that they're real because it's so intimidating. So anyway, I really wanted to thank everyone who participated, who asked these questions, and happy New Year to everyone. It was nice being able to do this experience for the first time with no CD. So I just wanted to thank everyone. And again, my name's Dr. Jesse Spiegel. I'm a psychologist. I'm licensed in California and New York, and I appreciate everyone who came out and asked all the wonderful questions. Okay. All right. Thank you. And have a good night. Happy New Year.